30 million Americans suffer from an eating disorder. I am one of them. In 2016, I was diagnosed with binge eating disorder. I sat down with some professionals to learn more about eating disorders, as this is National Eating Disorders Awareness Week. All week long, we will highlight eating disorders so we can educate you.
Some of the eating disorders can be a sense of body image and a strive to always be thinner. Some eating disorders is a loss of control, and along with that comes the guilt feelings and so forth. So there are all these different variations that separate them out, but they're all wrapped around that control of eating. So dealing with food that we all need every day to intake. That's what makes eating disorders a lot trickier, because we still all have to eat.
According to Dr. Sipple, people with eating disorders often have other mental health issues. This adds another layer of complexity to diagnostics and treatment.
Sometimes we see patients who have what's called comorbid illnesses, so meaning that those be present not only with eating disorders, but they may have things that wrap around with it, such as anxiety, major depressive disorder. We've even seen it with bipolar disorder and even other mental health illnesses. Recent studies have looked at approximately 80% of patients having any type of psychiatric illness may have the possibility with an eating disorder.
Symptoms vary based on the type of disorder.
It depends on the eating disorder. When it comes to binge eating disorder, that starts at the average age of about 18 years old, where anorexia and bulimia start at the average age of about 21. A lot of times it comes up more. It can come to someone's office as anxiety. Sometimes it's to a point they're having medical problems, whether it's with their GI system or even heart palpitations, chest discomfort, things like that. And that leads them to their family doc.
People sometimes don't know who to go to if they're looking for help.
A lot of times the very front lines can be from the PCP side of it for the person if they're concerned, worrying that they may have an eating disorder, so forth. They can even start off with their school counselor. A lot of times people will see them first, or sometimes we get folks referred by human resources from their job.
There are many ways doctors may treat someone with an eating disorder.
A few things that you can really prescribe. There's only 2 FDA indicated medications. The first one is for bulimia, and that's actually Prozac or fluoxetine. A lot of the other medications they've looked at that are serotonin based, some of the other antidepressants or anti-anxiety type medications have been used, but fluoxetine is the only one to have shown to break what's called the cycle of bulimia. That cycle being of dieting and then having the binge, the purge, and then the diet again. It's kind of a repetitive cycle. And it's the only medication that's been proved to actually break that cycle. The other portion is called Vyvanse. That's a stimulant that we can use most often for treating patients with ADHD. That medication actually has been approved for binge eating disorders.
Dr. Sipple believes it's imperative we discuss this because eating disorders are life-threatening.
The eating disorders actually have more deaths than any other mental illness per year. One person, 1 to 2 people every 62 minutes will die from an eating disorder.
In Erie, Emma Rose Lewis, YourErie.com.